Picture yourself as a World War II engineer, trying to figure out how to keep the Allies bombers safer. You study the planes that make it back, and see knots of bullet holes on their wings and tails. Should you add extra armor there? If you answered it yes, you have fallen into a classical logical trap. Abraham Ward realized that bullet holes showed where planes could take damage and still return to base. Planes hit in the engine or cockpit never returned it. And what he just noticed is a type of sampling bias known as survivorship bias. Survivorship bias can also quietly distort medical research. Sometimes it makes certain treatments look like miracles, even when they might actually be harmful. In medicine, survivorship bias happens when studies only look at people who make it through the selection process. They leave out those who are excluded, die early, or drop out. Let's look at real-world examples in emergency medicine. Suppose a hospital wants to try out a new aggressive treatment for severe trauma. Researchers must obtain the patient's consent before starting the trial. But who can actually give that permission? The answer is only patients who are stable enough to talk. If you study people who survive the first wave of trauma, your trial will make the treatment seem more effective than it really is. This bias also skews survival rates for deadly diseases. Survival numbers for aggressive cancers often look impressive because of survivorship bias. Younger, healthier patients with early symptoms are more likely to survive long enough to join these studies. On the other hand, older or sicker patients might pass away before they are even diagnosed or induced in a trial. Leaving out fatal cases creates an unrealistically positive picture of survival odds. This bias shows up outside of clinical trials too. For example, someone might say,
"My grandfather smoked 2 packs of cigarettes a day and lived to 95 years old. Smoking can't be that bad."
That is the core of survivorship bias. We only hear from the rare survivors. The many who died early are missing from these stories. To avoid being misled by data, researchers must hunt for what is missing. Medical researchers now carefully track why patients drop out of clinical trials. Often it is because the treatment didn't work for them or caused serious side effects. Statisticians now analyze trial data using all enrolled patients rather than only those who completed the program, including patients too sick to participate or who died early allows researchers to present a fuller picture of how a drug or procedure truly works. Medicine relies on data, but that data is only as strong as its source. When you hear about medical miracles, always ask whose results are missing. We learn the most from those not counted. And that is about it for this video. Thanks for watching.